name is Sabrina Wynne. I'm the physician assistant who's going to be examining you today. How are you doing today?
I'm good. How are you?
Good. Hannah, how old are you?
I'm 23.
23. And what's your date of birth?
10/25/1995.
Okay. And what do you do for a living?
I'm an ER tech.
Nice. And are you married? Do you have a boyfriend?
I do have a boyfriend.
Okay. Were you referred to me by anybody else?
No, I just came into it.
Okay. And what seems to be the problem? What's going on today?
I just had this weird rash on my leg.
Okay. And when did it first start? Do you remember?
About 2 days ago.
2 days ago. Okay. And do you know exactly what triggered the rash? What were you doing?
I was hiking over the weekend, so I don't know if something bit me.
Okay. And is there anything that makes it worse, like when you itch it or?
No, nothing really. Just
Okay.
nothing makes it better. Nothing worse.
Okay. And is there anything that makes it better? Any creams or?
No, I haven't really tried because it doesn't bother me. It's just like a rash.
Okay. And since you first noticed it, has it changed at all? Has it?
It's gotten a little bigger, but basically it's just the same like red circle.
Okay. And has this ever happened to you before?
No.
Okay. And is there any type of pain or itchiness in the
Not
rash?
really. No.
Okay. And does the rash move anywhere or travel anywhere else?
No, it's just really on my leg.
Okay. And so you haven't noticed it on any other parts of your body, a rash like that?
Mm-mm.
Okay. And on a scale of 1 to 10, I know you said you don't feel any itchiness, but do you feel any type of sensation on the rash?
No, not really. It's just a little
Okay.
bit like warm when I touch it, but that's it.
Okay. And associated with the rash, do you have any other symptoms?
I have been feeling really tired lately. I don't know if that's anything to do with it.
Okay, and is it more like fatigue, or do you feel any muscle weakness?
I think it's just like fatigue. I haven't really, just tired.
Okay. And have you noticed any other bumps or sores,
No.
itchiness,
No.
dryness,
No.
changes in the color of the rash,
It's just red. It hasn't really changed.
and any other changes in your skin?
No.
Okay. Changes in your hair or nails? And have you noticed any other types of moles?
No.
Okay. And where the rash is, have you noticed any muscle or joint pain?
I have noticed some joint pain.
Okay. Stiffness?
Not really, no.
Any backaches?
No.
Muscle swelling or redness? Pain?
No.
Okay. You said you feel fatigue rather than any actual muscle weakness?
Yeah.
Has your family members had any type of joint pain?
Not that I know of, no.
Okay, any muscle weakness? Does your family have any, take any medication for arthritis or?
No.
Okay. And do you put on sunblock when you go
Yeah.
outside? Okay. Do you put any creams on your skin? Any changes in your skincare routine?
No.
Anything like that? Okay. Any allergies to insects?
No. Not that I know of.
Okay. And do you take any medications at all?
Just birth control.
Birth control, and how frequently do you take that?
Every day.
Okay. Do you know the dosage?
Just one pill a day.
Okay. And orally?
Yeah.
Okay.
I don't know if there's sorry.
It's okay. Do you take any home remedies?
No.
Non-prescriptive drugs? Vitamins?
No.
Okay. Do you take any borrowed medications or
No.
medications that aren't prescribed to you?
Mm-mm.
Okay. Do you have any allergies, whether it's to insects, medications, the environment?
No.
Okay. And now we're going to move on to your childhood health. Have you ever been diagnosed with any childhood chronic illnesses?
Mm-mm.
Okay. No measles, mumps, rubella, chicken pox?
No.
Scarlet fever?
Nope.
Rheumatic fever?
Nope.
Whooping cough?
Yeah.
Okay. And as an adult, have you ever been diagnosed with hypertension,
No.
diabetes,
Mm-mm.
HIV,
No.
thyroid disorder,
No.
kidney disease,
No.
asthma?
No.
Besides for those, have you been diagnosed with anything else?
No.
Okay. Have you had any surgeries?
No.
Okay. Do you visit your gynecologist?
I do.
Okay. And when was your last menstrual cycle?
Now.
Okay. And is it regular?
Yeah.
Okay. And we're going to move on to some of your sexual history. Do you have sex with men, women, or both?
Men.
Okay. And how often do you use condoms?
All the time.
Good, good. And how many sexual partners have you had within the past 6 months?
One.
Okay. And how many sexual partners have you had in total since you became sexually active?
2.
Okay. Have you ever been diagnosed with any mental illnesses or had any psychiatric care?
No.
Okay. Any accidents or injuries?
I did dislocate my elbow.
Okay, and when was that? Do you remember?
Like 6 years ago.
6 years ago. Do you know what from?
I was in cheerleading. And fell.
Cheerleading. Okay.
Yeah.
And did you go to a hospital to get
Mm-hmm.
taken care of? Okay. Does it give you any pain anymore or?
Not really.
No.
Just, when it rains.
Okay. Any hospitalization?
No.
No. Okay. And have you had regular immunizations such as tetanus,
Mm-hmm.
pertussis,
Yeah.
MMR, varicella,
Yes.
influenza,
Yes.
hepatitis B,
Yes.
meningococcal, and HPV?
Yes.
Okay. And for routine screenings, have you gotten any mammograms?
No.
Pap smear?
Yes.
TB testing or PPD?
Yeah.
Okay. So now we're going to talk a little bit about your family history. How are your grandparents? Are they alive and well?
My mom passed away.
Okay. And do you know what age she was?
Just like last year. 85.
Oh, I'm so sorry.
She died from a stroke.
Okay. And any other relatives that have passed away?
And then my dad's dad died. He was 78 and passed away from lymphoma.
Okay. And what about your other grandparents? Are they?
They're alive and well.
Okay. Do you know how old they are now?
My mom's dad is 86. My dad's mom is. Hard question.
I know.
She's 82.
Okay. And how are your parents doing?
They're good.
They're good. They're alive and well?
Yep.
Okay. How old's your mom?
She is 54.
And your dad?
55.
Okay. And do you have any siblings?
Brother.
A brother, and how's he doing?
Good. Healthy.
Good, good. And you don't have any kids?
No.
Does any of your family members have history of hypertension?
Yeah. My grandfather that passed away.
Okay. How about lung disease?
No.
Renal disease?
No.
Thyroid disorder?
No.
Any cancer?
Yes. My
Like your-
grandfather that passed away.
Okay. Mental illness?
No.
And you said, was it your grandmom that had a stroke?
Mm-hmm.
Okay. Any coronary artery disease?
Yes. Grandpa passed away.
Diabetes?
Yeah. That's him. Yeah.
Okay. Is there anything else that may have not mentioned that they have history of?
And my grandma also had
to your social history. So where did you grow up at?
New Jersey.
New Jersey.
Yeah.
Located in like South Jersey or?
Yeah, in Burlington.
Burlington. Oh, okay. And how was your childhood?
It's good.
That's good. Did you go to school in Burlington?
I did.
Okay. Did you complete high school?
I did.
And did you seek any higher education?
I graduated from undergrad.
Okay, nice. What school?
At Rowan.
At Rowan, nice. And you said you work as an ER tech, right?
Mm-hmm.
And how do you like that?
That's good. Yeah. I don't really work much at school, but
yeah,
it's good.
That's understandable. And so you live with your parents, or?
Yeah.
Okay, and how's your relationship with them?
Good.
Good. And how's your home life? Do you have any stairs going into your house?
I do.
Okay, how many?
Like 8.
8, okay. And do you have all the safety precautions in check, like such as your smoke alarms and other things like that?
Yeah.
Okay. Do you have any pets?
I have 2 cats.
Nice. Okay. And are you able to get around the house okay?
Yep.
Okay.
No issues.
And do you have any military experience?
I don't.
Okay. Any other sources of stress in your life?
Just school.
Just school.
It's rough.
Yeah. That's understandable. And how's your financial situation?
Good.
Good? Okay.
No. It's gonna be bad in about a year when I finish school, but for now it's okay.
All those student loans. And what do you like to do for fun?
I like to go outside, kayak.
Nice.
So that's clearly why I got this.
Yeah, the rash. Makes sense. And are you religious?
I am.
Okay, and what religion do you practice?
I'm Christian.
Okay. Do you have any problems bathing, dressing,
No.
using the toilet,
No.
feeding? You can use the telephone, okay?
Yeah.
Shopping's good.
Oh yeah.
Do you prepare your own food?
I do.
Okay. How about housekeeping and laundry?
Yep.
And do you drive?
I do.
Okay. And do you always wear your seatbelt?
Of course.
Good. Good. And when you ride a bike, do you use your helmet?
Yeah.
And
I haven't rode a bike in a while though.
And what about sunblock? You always put on sunblock?
I'm very pale. Needs
And what about taking your contraceptives? Are you okay with taking medication?
Mm-hmm.
Okay. And managing money?
Yes.
And do you exercise at all frequently?
I try to.
Okay. And what kind of exercise do you do?
I like yoga.
Nice.
Starting that.
Nice.
Going good.
Yeah, I heard it's really good for you, meditation. And do you take your usual daily food intake, 3 meals a day?
Yep.
Okay, and what about fluids? Are you hydrated? You're still hydrated?
Always. I just ran out of water. Worked out.
Good. And how's your caffeine intake? Do you drink any coffee?
Normally like 1 cup a day.
Okay. How's your sleeping habits? Okay, you're sleeping all right. Do you take any naps during the day?
I used to, not
Not anymore.
I really like my naps.
And you said you're interested in men. So besides for yoga, do you do any other alternative healthcare practices?
No, I don't.
Okay. And do you ever feel like you're not safe in your home or in your relationship?
No.
Okay. Do you use any, do you smoke at all? Use any tobacco?
No.
Okay, what about alcohol? Do you drink alcohol?
Occasionally.
Occasionally, okay. And on those occasions, how much do you normally drink?
Like a glass or 1 or 2, like a week. Once a week.
And what kind of alcohol do you drink?
Wine.
Wine, okay. So now I'm going to ask you a couple questions. It might seem like 100 questions. We'll try to get through it as quickly as possible, okay?
Okay.
And have you noticed any recent weight gain, abnormal weight gain or weight loss?
No.
Are your clothes fitting okay?
Yep.
Okay. Any muscle weakness at all anywhere else?
Just like recently, but no, nothing.
Okay. What about fever?
I did have a slight fever yesterday. I didn't take my temperature today, though.
Okay. And besides, so you mentioned that you have fatigue ever since getting your rash. What about before that? Any fatigue?
No.
No? Okay. Any dizziness or lightheadedness?
No.
Any recent head injuries?
No.
Okay. Have you noticed anything different with your vision? Any trouble seeing?
Mm-hmm.
Do you normally wear glasses?
No.
Okay. What about hearing? Do you ever get earaches or any discharge from your ears?
No.
Okay. Any recent infections in your ears?
Mm-hmm.
And how's your nose? Do you have any discharge from your nose? Any itchiness?
No.
Nosebleeds?
No.
Frequent colds?
No.
Okay. And your throat? Do you have any sore throat or hoarseness?
No.
What about sore tongue?
No.
No? Dry mouth?
No.
No bleeding of your gums or anything like that? Okay. Do you see your dentist regularly?
Do. I haven't been there in a while. Normally go.
What about your neck? Any swollen glands?
No.
Okay. Lumps, bumps, pain or stiffness in your neck? What about your breast? Do you do regular self-breast exams?
I don't.
You don't? Okay. Maybe we could try to get in contact with your OBGYN to kind of, or even myself can help you educate you into learning how to do self-breast exams.
Okay, sounds good.
Okay. Any coughs?
No.
Changes in the color of your sputum?
Mm-mm.
Presence of blood?
No.
Any shortness of breath?
Mm-mm.
Wheezing or pain?
No.
Okay. No history of asthma, bronchitis? Have you ever had any chest pains or do you ever use a pillow at night to use your breathing? Or
No.
do you ever feel like you have to sit up to use your breathing? Okay. Your stomach? Any swellings in your hands, ankles, or feet?
Not that I noticed.
Okay. Hypertension? Have you ever had any trouble swallowing or any heartburn after you eat?
No.
Changes in your appetite?
No. Actually, I've been increasingly hungry lately. I eat a lot more than I ever have. Probably just stress, but
Okay.
I don't know. I'm not really sure.
Okay.
Probably gonna gain 30 pounds.
Okay, so you've had like some abnormal weight gain recently,
No.
or just?
I probably
just
will because
been
I've been
eating
eating
a lot. Okay.
Stress.
Any abdominal pain
No.
with that? Okay. Excessive belching or passing of gas?
Mm-mm.
Any history of jaundice, liver, or gallbladder problems?
Mm-mm.
Have you ever noticed any leg cramps or swelling in your calves, legs, or feet?
No.
Okay. Any redness or tenderness? What about urination? Do you have any burning or pain when you urinate?
No.
Any urgency?
Mm-mm.
Blood in the urine?
No.
History of kidney stones?
No.
Okay. Any vaginal discharge, itching? No?
Mm-mm.
Lumps or sores?
No.
Okay. Any pregnancies or abortions?
No.
Okay. Any changes in sexual habits or behaviors?
No.
You said you've had joint pain and you don't have any muscle pain? Is that?
No, just really joint pain.
Okay. Any back aches?
No.
Do you ever feel excessively nervous?
No.
Any changes in your mood?
Not really, no.
Any history of depression or anxiety? Do you ever feel like you need to hurt yourself or anyone else?
No.
Okay. Any past counseling or psychotherapy?
No.
Okay. Any changes in your attention span? Your speech? Any changes in your memory?
No.
Okay. Any fainting or blacking out?
No.
Any numbness or loss in sensation?
No.
Tinglingness? Okay. Any seizures?
No.
And do you bleed or bruise easily?
No.
Any history of anemia?
No.
Okay. And have you ever had any history of thyroid trouble?
No.
Heat or cold intolerance?
Mm-mm.
Excessive sweating or excessive thirst? Okay. Any change in glove or shoe size?
No.
Okay. Well, it was a pleasure meeting you today, Hannah. That concludes our interview.